It's truck talk. I haven't been in my truck in a while, so my wife got a minivan for our ever-growing family, and so we decided to keep her old car. It's like a 2006 Kia Rio, and it's like a little go-kart. It gets like 30 miles to the gallon. My truck gets more like 20, and so I told her, I was like, hey, I don't want to trade this in because I just want to drive that thing back and forth to work. She's like, why? I'm parking my nice truck to drive a 10-year-old little gas-friendly vehicle back and forth to work. So I haven't had the opportunity to do any truck talk in a while. So so today I wanted to talk a quick. I just had a conversation with someone who works with our clients a lot, and Dr. Travis Fleming. He's a local chiropractor, and we talk a lot about this. And the topic came up again in our talk this morning about a patient and client, and it's the topic of, just because you're having no symptoms does not mean that you are healthy. And I see this a lot on the fitness side of things, whereas I've had this conversation. The person is 340 pounds or more. 340 is just a random number I'm throwing out there because it seems like a large number. But the person might be in the 300s club of body weight. And they said, but all my blood work comes back fine. And, well, the doctor says I'm healthy as a horse. That seems to be the term. And I'm like, no, you are a horse. And it's not a bad way. I don't mean that to be, upsetting to someone that's a bigger person. But what I'm saying is, that person who obviously has a weight issue, or that person who, maybe I'm not having any issues with blood pressure or anything else. It's just give it time. And the comment that the doc and I were talking about today is, he said, well, this patient, I think it's just catching up with them. And what we realize is that, I've had movement pattern issues with this client for years that we've been addressing, and now 3 or 4 years later, symptoms arise, and essentially it's because of the problem in movement patterns that have been going on for years, and not just 3 to 4 years, just the amount of time that we've been working on it. This might have been muscle imbalances and muscle activation issues that have been going on for a decade. But because there were no symptoms that the patient felt, there was no treatment being done. And there is a major benefit to preventative care or maintenance care. When I go into my fitness, I am typically not going into my fitness routine with a mindset of treatment, okay? There are certain things that I do that are treatment-based, but most of what I do is maintenance-based or preventative-based. I'm not working out hard at 33 because I'm trying to, perform this amazing feat at 33. No, I'm setting the stage for what I want to see at 63 and for what I want to see at 83. I eat now so that I can prevent the issues that could be coming, or that I can maintain the quality of life that I currently have long term. So I want to keep this short, but if I could just hit home on one thing. Just because you're not having symptoms of something does not mean that you are in a healthy state. If that's fitness, if that's chiropractic care, if that's going to the doctor. I'm terrible at this. I haven't been to the doctor in 7 years. Why? Because I haven't had any symptoms. I got to go to the doctor. Like, I should be getting regular physicals. I should be getting regular blood work done, because just because there's a lack of symptoms does not mean there's a lack of a problem. And I hope that helps you. Maybe that just kind of spoke to me today, and I wanted to share it with everybody else. So anyways, have a great day. Maybe we'll bring some Kia talk to you, since truck talk is few and far between these days. See you guys.